Hi, good afternoon, everyone. I welcome you all to another session of Sphere India COVID-19 Academy. Sphere India COVID-19 Academy is a joint initiative of WHO, NIDM, UNICEF India, and HCL Foundation to train and enhance the capacities of our frontline volunteers and workers. Today, the Academy brings to you a very interesting session on self-care, health, and infection prevention for the people with disabilities during COVID-19. So every individual is expected to manage self-care and health needs in response to COVID-19. People with disabilities have particular needs that require special attention. For people with profound disability, it might be difficult to execute their entire self-care task. Hence, they may need assistance from family members or external caregivers. For example, anybody who is using a wheelchair may need to do pressure relief in certain times interval, which is also an example of someone who is specially able or self-care example. Today's course will ensure that the participants understand the vital dynamics between people with disabilities and caregivers in regards to this COVID-19 pandemic. Importance of self-care and personal hygiene with respect to persons with disabilities, challenges and barriers to care and maintaining personal hygiene for such people. To deliver the session, we have our two speakers with us. Our first speaker for the session is Miss Smriti Suval, who is she's from Handicap International. Ms. Smriti is a physiotherapist by profession, and she holds more than 8 years of experience working in synergy with health systems, especially in expanding the coverage of rehabilitation, promoting the financial access, and imparting the sense of rehabilitation ownership to the government stakeholders. In her current role with Handicap International, she has been involved working in close coordination with Ministry of Health and Population Nepal in providing technical support in developing national level strategies and policies related to disability and rehabilitation. Welcome, Smriti, to this Sphere India Academy session. We have another speaker who is Mr. Yeti Raj Nirula. He is also from Handicap International. He is a prosthetist and orthoist by profession. He has been working with Handicap International Nepal program since 5 years. Currently, he is working as a senior orthoist and capacity building officer. He is mainly responsible for planning, implementing, monitoring, and supervising the activities which is related to assistive products and technologies from HI and its partner organizations. As a secretary in Prosthetics Orthotics Society Nepal, he has also contributed for the development of POE sector in Nepal. He has also contributed in the development of priority assistive product list of Nepal and other such guidelines in the same country. I welcome you, sir, to this session. We have with us Ms. Anupriya, who is from Vishesh, and she is an expert of Indian Sign Language interpretation and also a trainer from Vishesh. So I welcome you as well, Anu, for this session. With this, I would like to hand over to our first speaker, Ms. Smriti, to take forward the session. Thank you.
All right, good afternoon to all. My name is Smriti Suwal. I'm a senior liaison officer for Handicap International Nepal. First of all, I would like to thank Spare India team for providing this opportunity to be the part of the webinar session. Similarly, I would like to thank HI Team India for all the coordination and support provided for the webinar. So today I'll be talking on approaches to self-care, caregiving to persons with disabilities in context of COVID response. I would get straight into it and start with a brief overview of my presentation. So first, I'll be starting with why additional considerations are needed for persons with disabilities during COVID-19 outbreak. Likewise, I'll be talking on self-care and caregiving approaches. I'll be also sharing HI Nepal's experience working in coordination with Ministry of Health and Population in context of COVID-19 related to self-care and caregiving. And lastly, my colleague from HI Nepal will be taking a session on how to take care of assistive devices in context on COVID-19. So starting with a brief overview, we know that WHO announced COVID-19 outbreak as a pandemic on 11th March 2020, which is a public health emergency of international concern. With more than 91 lakhs confirmed cases worldwide as of 23rd of June 2020. Even though disability inclusive disaggregated data is a global agreed norms in the context of public health emergencies, but unfortunately, in context of COVID-19, disability data is missing, as we can see data are disaggregated by age, gender, number of infected cases, recovered deaths, and so on. So apart from this, having a gap in disability inclusive data, there is also no defined mechanism in the health system, like to incorporate service provision on disability and inclusive health and rehabilitation in context of COVID-19. Because of this, the resilience is very poor, and obviously the access to health service in these domains are going to be jeopardized. So the message is that we need to work for system strengthening of disability inclusive health and rehabilitation. Then only we can expect good response in this type of public health emergency. So moving on to my next presentation, next slide. Why additional considerations? Persons with disabilities may be at greater risk of contracting COVID-19 because of physical barriers to water and sanitation hygiene facilities. They may need to touch things around, for example, assistive devices for mobility, and also may require support, assistance from their caregivers to perform activities of daily living in which physical distancing cannot, or it might be very difficult to be avoided. So there are also lots of advisories made from government, like health updates, guidelines for health professionals, also guidelines for general population in regard to COVID-19 context. But these informations needs to be accessible as disability inclusive risk communication materials, as persons with disabilities are more vulnerable for COVID-19 contraction, as I've already explained in the above points. So therefore, additional consideration is required. Now, before talking about self-care and caregivers' approach, let me also talk in brief about this pyramid. This is a rehabilitation health framework. And if you see the base of the pyramid, which holds the largest volume of rehabilitation, which actually is informal and self-directed rehabilitation, it signifies the self-care, care that is done by persons with disability to him or herself, and taking care, taking help from caregivers or family members or external caregivers at home and or community level. So this pyramid signifies how important is self-care and caregiving for persons with disabilities. So now here are some important considerations for self-care by persons with disabilities, like essential health products, like catheters, diapers, urinary bags, gelatin jelly, for persons with spinal cord injury, for stroke or any kind of profound disabilities may require these products. And due to the lockdown situation, these products might not be easily available, causing disturbance in medical supply chain, resulting in limited availability or difficult to procure. On the other hand, income-generating activities due to lockdown may also forbid some persons with disability to access these products. So it is advised to keep the stock for these products at least for a month, which is also recommended by WHO. And similarly, essential items like soap, towel, and the sanitizers also needs to be kept nearby the area at their house where they can easily get access to. So now talking about, it's like very important for everyone to know and have information on hotlines and support mechanism that government is providing in context of COVID-19. So does it apply for persons with disabilities? So having said this, persons with disabilities might not know the availability of hotline numbers or any support provided by government, any organizations or community, simply because of inaccessible mode of communication. So it's very important to make all this information accessible to persons with disabilities. This way, they can update themselves on the relevant source of information to take care of themselves. Now, talking about seeking health and rehabilitation follow-up, sometimes persons with disabilities, they may need to seek health and rehabilitation services, not necessarily for COVID-related reasons, but due to their underlying health conditions. Maybe, for example, they need to visit their physiotherapist for follow-up sessions. They need to, go and get their wheelchair cushion replaced because it's torn, or maybe they need to go and get a new prosthetic because it's broken, and many more other examples. So at this point of pandemic, it's very important to decide what kind of service needs to be delivered, whether to conduct remote rehabilitation or to conduct face-to-face rehabilitation, depending upon essential rehabilitation service, of course, by following infection prevention controls. I'll be talking in my next slide about essential rehabilitation services. And as you see, as I already said that in the above points, persons with disabilities, they may need frequent health and rehabilitation follow-ups. And rehabilitation is an important service that many persons with disability may require. But however, 63% of the countries in the world are facing disruption of rehabilitation service, according to WHO. And there is a need to prioritize rehabilitation in national interim guidelines of government as well, that are developed in context of COVID-19. So it's very important to have disability, inclusive health, and rehabilitation incorporated in those national guidelines. As I see, there are lots of interim guidelines being developed in many countries related to health services like nutrition, immunization, sexual and reproductive health, and etc. So it's important to have interim guidelines on rehabilitation with specific portion on self-care and caregiving. Hence, once it's addressed in national documents, then it will be easy to implement those into actions. Now, talking about essential rehabilitations, it's the service that is very much required to maintain the functional outcomes and avoid the mortality and morbidity of the individuals with several impairments and its complications. For example, people with new injuries such as burns, spinal cord injury, musculoskeletal problems, and recovering from surgeries, a person who required to replace their assistive device. So these are the examples of essential rehabilitation service according to WHO guideline. So based on this priority, face-to-face rehabilitation or remote rehabilitation could be planned. And why I'm saying this is because caregiving and self-care is also part of this kind of rehabilitation intervention. So as we know, many persons with disabilities, they require assistance, support from their family members to perform their activities of daily living. And in this state of time, taking care, family members, if they are not having any symptoms, and even persons with disabilities are not having any symptoms regard to COVID-19, then there is also no need to wear masks. This is the practice that we are following in Nepal at the moment. So as we also talk about simple caregiving, basic caregiving, practices made in the country, it would be very good if family members, they know about basic skills on caregiving, such as doing safe transfer, positioning care, hygiene and sanitation measures, because sometimes persons with disabilities may require assistance in changing catheters, changing urinary bag, cleaning wheelchairs. It might be very essential for them. So for all these activities, family members' role would be very crucial, of course, by following national infection prevention control measures. And there might be external caregivers as well, apart from caregivers, family members themselves. So obviously, these external caregivers, they need to travel to and fro to persons with disabilities' house to conduct home visits, which might lead to high chance of infection. So it would be good to explore another option if family members themselves could continue to provide assistance, to provide rehabilitation service to persons with disabilities on whatever rehabilitation services was provided by external caregiver. So this way infection can be reduced. And of course, external caregivers, they need to strictly follow infection prevention control measures by wearing a mask and by by washing their hands before and after the rehabilitation sessions. And also we know that there might be many external agencies who hire caregivers, external caregivers, So in this situation of pandemic, those external agencies should also repurpose the duty schedules. For example, if they are mobilizing one caregiver for a week, then he or she needs to be given a break for few days, and then again mobilize next caregivers. So in this way, the infection control can also be reduced. Now, let me talk about HI Nepal's experience in collaboration with Ministry of Health and Population in context of COVID-19 related to self-care and caregiving. So, as we know that risk communication is very important as we can disseminate many information related to self-care and caregiving. But it has to be disability inclusive. And there are two ways of risk communication approaches which we have done in Nepal. So one is making mainstream risk communication inclusive on messages, for example, how to clean hands, what are the symptoms of COVID-19. And another one is creating disability specific risk communication message on self-care, taking care about assistive devices and how family members, how external caregivers can take care of persons with disabilities. So, of course, in this way, risk communication it can be developed and disseminated through appropriate channels. And in Nepal, we have developed risk communication materials, videos, and IC materials in collaboration with Ministry of Health and Population, World Health Organization Nepal, National Federation of Disabled People, and Handicap International. So, and very importantly, I have already mentioned earlier also, interim guidelines are being developed at ministerial level, not only in Nepal, but in many other countries as well. So this kind of interim guideline should have a specific section on disability inclusive health and rehabilitation services. Within that also, a specific section should be on caregiving and self-care, which is very much important in this pandemic context for a person with disability to maintain their health and to prevent themselves from COVID contraction. So having these things incorporated in national interim guidelines, in Nepal, we are on the process to develop interim guidelines, one on disability and rehabilitation inclusive health service in COVID-19 pandemic, and another one is interim guideline for health-related rehabilitation for persons with COVID-19. Yeah, so that's all from my side. Thank you. And now my colleague will take over the next topic. Thank you.
Hello, Yeti, are you there?
Hello, good afternoon to everyone. My name is Etiraj Nirola, and I'm a prosthetist and orthotist by profession. In HI Nepal, I have been working as a senior capacity building officer. And thank you, Sphere India, for providing this opportunity to share the information on assistive devices, its care, and also the HI India for necessary coordination. Thank you, Smriti. And now my topic is moreover focused on the assistive devices. It's what are assistive devices, what does they include, and how the services, the interruptions are affected in COVID-19 situations, and what are the uh, practices, what are the safe and caretaking practice that a person with disability and their caregiver can practice and can follow during these situations to prevent themselves from adverse situations. So let me begin with the assistive devices. Assistive devices are the external devices that are designed, made, or adapted to assist a person to perform a particular task. Hence, this could be any product, instrument, it could be an equipment or a technology adapted or especially designed products. As from WHO, 1 billion people globally are in need of assistive products, but unfortunately, only 10% of the people are able to access these services. To improve the access, to improve the availability of the assistive products, and to support member states to improve the assistive products provision in their own countries, WHO published assistive priority list in 2016, consisting of various assistive products which are essential and important for the people to uh, use and to improve themselves. So you can see the picture of assistive products. This is the list of several products which is produced by WHO. Similarly, who needs assistive devices? As we all know, person with disabilities, they need assistive devices. Apart from person with disability, older people, people with non-communicable diseases, similarly people with mental health conditions including dementia and autism, and people with gradual functional decline are in a deep need of assistive devices. Assistive devices are essential because they help to compensate for impairment and loss of intrinsic capacity several due to different situations, different health conditions and impairments. The person are experiencing loss of their capacity, loss of their functions, and the devices are help assisting in compensating these lost functions. Similarly, it reduces the consequences of the gradual functional decline, and it helps to minimize the need for caregivers because significant amount of time and effort are needed for several caregivers to take care of the persons with disabilities or the people who have lost their functions or who have experiencing gradual functional decline. Additionally, these devices also helps to prevent the primary and secondary health conditions. And due to the preventions of these conditions, many people experience lower health and welfare costs. So significantly, in a larger frame, in a larger perspective, the assistive device also helps to reduce the health and welfare cost. So looking at the different types of assistive devices included in WHO APL, that is assistive priority list, there are around 50 devices which are under the domains of mobility, vision, hearing, communication, cognition, and environment. Some of them are prosthesis, orthosis. Prosthesis are the devices which are used to replace the missing limbs. Similarly, orthosis are the external devices which supports the weakened part of the body. Walking aids helps the people to walk with support, and wheelchairs are the wheeled mobility devices which helps the people to gain independence. Similarly, there are various hearing aids which enable the people to improve their hearing function, and similarly spectacles, digital assistants, pill organizers, communication softwares are other assistive devices. Looking at Nepal, Nepal has published its priority assistive product list in 2018, and hence it became the second country in the world to prioritize assistive devices. Assistive devices are often a first step towards getting out of bed and out of one's house, accessing education, work, and employment, escaping from poverty and hunger, because many people are bound to get to have isolations, to be left behind because of their functional declination, and also assistive devices helps to improve their functional outcomes, and which makes them able to participate in the society. The devices helps improves the greater mobility, freedom, and independence, ultimately enhances the inclusion and participation in the society, finally contributing to the leading in a dignified life. So talking on person with disability, why assistive devices are important for them. So as persons with disabilities are continuously experiencing several functional limitations, and the devices helps to maintain or improve the functional functions and independence, to facilitate participation and to enhance overall well-being. So it helps them to perform various tasks that are otherwise very difficult for them to do it, or it some are some looks very much impossible to perform those tasks. So this assistive device helps to achieve the performance of those tasks. The devices also helps them to participate in work and social situations more effectively and actively. So talking on the COVID-19 and its impact on the person of disabilities using assistive devices, uh, we all know that the care and support that are needed for assistive device users have been interrupted, or somewhere it's stopped because of the COVID-19 situations and the lockdowns. So due to that reason, many people are not able to access essential services for assistive devices. So talking about essential services on assistive devices, it could be the repair and maintenance, or the replacement, because some assistive devices will be losing their lifespan, and some might be uh, uh, getting degenerated, and something like some might experience some damages, so that without the proper and continuous service, the persons might experience a big limitations, which on the other hand have provided by the use of these assistive devices and made them independent. So due to these interruptions, functional independency of the persons using those devices have been reduced, and it is the untimely remedy of the problems have affected the declinations and the limitations on the functional uh, independency. So due to this, they are experienced a severe impact on health conditions, because they are not able to perform their task, they are not able to take care, and they are not able to maintain their daily activities, so which is resulting a negative impact on their health conditions. And the other hand, the vulnerability is very high for the person with disability who are using assistive devices, because uh, the continuous physical contact would be there, and there is a higher risk of the virus contamination because of the devices contacting several surfaces which are contaminated, and the transmissions is very likely to happen. So what are the care that has to be followed for assistive devices during COVID-19 pandemic by the users or their caregivers? Is this the devices should be taken care with the frequent sanitizing and cleaning, because we know that uh, the cleaning and disinfecting the devices would help in limiting the spread of the virus, and its frequent cleaning and sanitation would be essential for them to use their devices appropriately and limit the contamination. And do that, all the solid surfaces that are touched have to be cleaned, have to be sanitized or disinfected. As there are varieties of assistive devices, proper guidance on sanitation with the AT specialist would be valuable, because different devices requires different processes of sanitization, because it as it is important that all the devices have different mechanisms, different technologies, and different processes which have to be followed for its cleaning, its sanitizing. So just for an example, to clean wheelchair push rims, a person can spin around circles, but he must be careful with the splash, because that's splash could be resulting on the spread of the virus if it is there. So similarly, for understanding the disinfecting materials, it can be disinfected with the 10% solution of bleach or alcohol wipes, because that is the most common disinfecting items. Alcohol wipes, in the absence of these materials, antibacterial soap water can also be used, because looking at the local resources, local areas, the alcohol wipes might not be available. So having frequent cleaning, frequent with antibacterial soap would also help them to maintain the care for the devices. But it is very essential to follow the hand hygiene uh, before and after doing this task, because the surfaces might contaminate the hand, and which might further spread to nose, mouth, and eyes of a person, hence leading to the COVID-19 infection. For other care, for looking at the care, regular maintenance and basic repairs of the devices are also very important. So routine care as instructed by the service personnel is important. Here, service personnel, the contact, the connect, the communication with service personnel or the specialist or professionals is very important for the users, for the caregivers to do the optimal care of the devices. And generally during the service provision, this should be integrated to train the person with disabilities or their caregivers in the need of assistance to follow these all tasks, to keep the device in an up-to-date and intact situations. So and users during this lockdown period, users are very much liable to experience trouble on their devices, if there are and they might experience the further problems with their activities. And so training means users should be trained in basic maintenance of their assistive devices, which are generally done. And in addition to this training, users should have basic tools such as allen keys, hexagonal keys, spanners, etc. with them, because in the lockdown, all the service providers might and the services might be in interrupted situations, and some service providers may have stopped their services uh, due to the vulnerable situation. So in that situation, it is very likely for the persons to get uh, uh, limited or restricted with the services that are very essential for the person. So and in this situation, having tools with them, some basic tools, may help them to keep their devices in up-to-date situation, or uh, manage some basic kind of repairs, basic kind of maintenance in their home, which prevent them to reach to the service centers during these times. And very important, the teleconsultations with professionals are also is important, because being in a close communication with professionals would help the users to solve the problems at their home. And continuous teleconsultation will guide them on the maintenance, on the sanitization, on their use of the devices in this situation, so which will help them the prevention of the COVID-19 to them and their caregivers, and also to improve the functions of their devices to add the lifespan. Hence plays a very significant role in uh, this care of the devices and the persons with disabilities during this pandemic. Uh, Hence, with this slide, I will I'll be ending my session, and thank you very much.
Thank you, Rahul, for that. Thank you, Rahul and Smriti, for that amazing session. So now I will open the session for the participants. You can raise your hands if you have any question with the speakers, and I'll unmute you one by one so that you can ask your questions. You can also, if you have difficulty in speaking, you can also post your questions in the chat box and we'll pick the questions. So you can raise your hand if anybody from the participant has any question, please raise your hand. Well, I don't see any participant raising any hand. There was one question, although it's for both of you. I'll read that question out. It came in the chat box. Uh, Sophia has asked that how to educate people who are visually handicapped people. So how can we educate them? So is there any material, contact, anything? Smriti or Heti, anybody would like
Okay,
to?
can I take that question?
Sure.
Well, I think the question is about how do you develop IC materials, right? So for me, if it's in case of like complete vision impaired, obviously there should be a braille. IC should be in the form of braille, and even we can develop messages that can be broadcasted on radio, televisions, which is known as public service announcement. So in this way, messages can be broadcasted, and for even low vision impaired persons, ICs can be developed in regard to having a large font so that they can read it properly. And regarding the training, also, I think she is asked to contact with some trainers in Nepal regarding this. Is that the question?
Yeah, she also wants to know where can she find the materials or where can she make a contact to such kind of trainers. She also wants.
For that, we can have a contact with disabled people organizations. There are like few organizations who are working here in Nepal, and they are also developing IC materials for vision impaired persons. So we can definitely get her in contact with them.
Okay. We have another question in the chat box. I'll read that for you, the speakers. It's from Sukant Panda. He's asking that can you please share some government special schemes that are made available during this pandemic except the regular supports for the disabled people? Smriti or Kitty, anybody has anything, any scheme which is any special scheme available?
Uh, for special schemes, that has been, because in the Indian government definitely have might have published schemes on regarding the persons with disabilities to on COVID-19 services. So I think it would be very much important to check the ministry of health guidelines, and the informations being continuously involved in information would be helpful for this. But if we take the considerations of Nepal, then definitely Ministry of Health and Populations are publishing guidelines, and as Smriti has already shared about IEC, materials have been displayed in utilizing the sign language interpretation to make it highly inclusive for the people uh, who can access this material. So similarly, the government from India must have done such kind of information dissemination. I think that would be very helpful for this.
So adding on this, I'd also like to say something. There are like lots of guidelines being developed in context of Nepal, like regard to rehabilitation, which is on the process at the moment. So HI Nepal is also collaborating and developing these guidelines in coordination with Ministry of Health and Population. And once these guidelines are developed and then endorsed, then definitely it will be published online. So everyone can easily get access to those guidelines as well.
Okay, thank you for that brief response. We have another question from Aisha. She's asking that, are there any existing tele-support helpline numbers from where users can seek some help regarding sanitizing, maintaining their ADs?
Generally, in consideration of assistive devices globally, there are not much very uh, visual informations on this, but you can find many written articles that are published by the persons with disabilities and the innovators on disinfecting the devices and the proper care during the use. So I think that would be very essential for you to understand that exactly how these processes are being done. And as I already said, that it is very important, also important to be in contact with your service providers, or like professionals who is providing the service, that they may help you in the very needed time on the process of sanitization or process of caring the devices.
Yeah, this is like very good question. Like I've already mentioned in my presentation, it's very important. All these things needs to be addressed in government level, in national level, in the documents, then it will be much more easier to get implemented in action, obviously. So what I think is like all these things like getting in touch with hotline numbers, whatever service provisions are made by government, in regard to persons with disabilities, it should be incorporated and it should be accessible to all the persons with disabilities so that they can get easily all this information and they can take care of themselves.
Okay. I can see Dr. Suchita Rao raising her hand. So I'm unmuting you, ma'am. You have to accept the request. Yes, ma'am. Please go ahead and ask your question.
Actually, we have one our visually challenged students who have done their computer education in DCA have any opportunities to they want to do the work from home. In our NGO, we give this computer training to our visually challengers, and the same time we also train with autism children and special intellectual disability and hearing impaired also. So we have they have the much more of knowledge. If given any opportunity work from home, then we place out till now on our childrens.
So you're asking about the opportunities that are available for
Yes,
those
yes, yes, yes,
children.
yes. Yes.
Okay,
In
okay, okay.
Visakhapatnam, actually, we are working from last 10 years. We thousands of children we can place out, but till now in this COVID-19, this is going on very bad effect to our special children. And in this COVID-19, we give one campaign to give that ration kits. More than 1873 persons we can identify in these 3 months who are completely unemployed. So who are working in music systems, music work, visually challengers, they are completely unemployed right now. They don't have an opportunity to, they can give the programs and singing programs in outside. So what is the next level? How can we can help to them?
I think I don't have very ready-made answer for this question, but the one recommendations that I can, you can connect with the disabled people organization who can really connect you to the employers or the organizations where such kind of employment opportunities could be generated.
Yeah, definitely. Even I think this is very unfortunate, like not only during the pandemic context, even before than that, there are like very less opportunities for persons with disabilities, especially as ma'am said that children with autism and all. So even I recommend to be in touch with special organizations, like there might be Autism Care Society or, like for the persons with disabilities and all. So maybe having contact with them, sharing the views, the problems, challenges, they might have some opportunities for these kids.
Okay, thank you for answering that, Smriti. We have another question from Clarionda. He's asking, when PWDs are not able to visit Center for Rehabilitation Therapy that they require, by what other means apart from self-therapy can we include and encourage therapy during these times? By these
Okay.
times, it means pandemic.
Uh-huh. So it means like if persons with disabilities cannot visit to the center himself, right? So at this time of pandemic, there can be another opportunity to explore on telerehabilitation as well. The service providers, rehabilitation professionals themselves can contact persons with disabilities and provide telerehabilitation via phone or by video calls and all. That could be one option. And another could be rehab professionals, they going themselves to conduct home visits of the clients. So that could be another options as well if client himself cannot visit to the center.
Thank you very much. Another participant has written in the chat box that um, he's asking how to ensure supports and services to persons with disabilities continues interrupted at the same time, maintaining social distancing. How do we ensure that the support and services are reaching to them? Also, we have to maintain the social distancing. So, how do we do both things at one point of time? Hello.
Uh, uh, the first and foremost thing is to ensure the infection prevention measures, and then consider the supports and services to the, because uh, service and supports are equally important for them. So maintaining social distancing uh, is uh, is also important, but the situation is that if you have taken proper infection control measures, then uh, you can facilitate several supports to them, and there are also several supports that can be provided to the people through distant guidings, and similarly, for example, let's say if a person is in need of some informations on assistive devices or the care, then I think maintaining the social distancing, the support and the information dissemination can be provided to the persons. If you are very much aware on the proper procedures, then you can also instruct the person with disabilities with such kind of support, or you can also connect the person with to the service providers or the professionals whom they can get much more specific supports.
Thank you, Yeti, for explaining that. Also, there is Sarita Singh. She's asking that physical challenge is one aspect of disability, but there are people who are also suffering from some kind of mental issues. So, what are the chances of their vocational training? Is there any sort of training available for them?
Yeah, for me, this is like very challenging, especially with, like psychologically challenged people. For me, I think it would be better to do training to their family members as well for them to understand how to take care of those people, during this pandemic context. So developing training packages to family and caregivers would be one of the recommendations.
Okay, great. Thank you. So we have another question, which is how to address the issue of livelihood, especially for the differently abled migrants. Any support provision by the government or private or NGOs, CSOs, because they are the worst affected, and amongst them also, if there is somebody who is specially able, things get more difficult for them. So is there some kind of thing available for them, or what is it that CSOs or civil society organizations should do for them?
The issue of livelihood, definitely this is a very significant challenges for the migrants during this time. uh, I think the recommendation again will be to be means to communicate with the responsible organizations, or the disabled, the people, the organization which are working for the migrants, and seek the opportunities if there are available, and if the government has provided such kind of a support to the people, that would be very much relevant to address this issue.
Thank you for that. There's a lot of questions coming in from the participants. So one more is there. This is like, is there any special training, capacity building program for parents or guardians who are taking care of the children or anybody senior or any person with disabilities in their own home? So is there any kind of special training material for them?
You mean to say that special training in the Indian context or in a global context? So definitely there are trainings in a capacity programs for parents and guardians in a global training perspective. And I think for Indian context, again, it will be very much relevant to get the proper information from the uh, the organizations working over there. So that would be very much helpful to understand the Indian context and the trainings necessary for the parents and guardians over there.
Does this mean like a training package regard to pandemic during the pandemic context? I didn't understand the question clearly, but if it's relevant to children with disabilities during this pandemic context, then obviously we need to do collaboration with special schools or special organizations working for them, and then form the training package.
I think as of now, the question does not specifically specify if it's a pandemic or in general. But yes, so if it's for pandemic, collaboration is needed. So there's another question. Daniel is asking to the speakers that how could services to PWD who are staying in remote villages, even if in India or in Nepal, how could services reach to them during this lockdown? Because countries are going through their own set of lockdown. So if there is
uh,
any essential services, how do we cater to
yeah,
that?
yeah, definitely lockdown has obstructed many services and resulting in the interruption of the continuum services. So to reach the person with disability during this the tele rehabilitation has been the most effective services, and also uh, the the remote services. It's also important to be connected with the service providers. If the person with disabilities have already access to the services previously, they can reconnect to the service providers and plan on the services that are needed, because during this lockdown, definitely face to face service delivery might be a challenge. So alternative mechanisms would prove beneficial to prevent the persons with disability uh, get means interrupted from the services. Hence alternative service mechanisms from face to face consultation would be very relevant.
Okay, thank you for answering that. Uh, there's this last question which I would take from the participants is there any special provision by the government for regaining the livelihood of these families? I think most of it has already been addressed, but is there anything additional you want to elaborate on this question?
Special provision by government for regaining the livelihood of these families, uh, uh, um, definitely there specifically that this kind of provisions has been proposed by Indian government. I think we are not the right person to say that, but I think there might be several uh, government provisions which have been means brought forward during this time of pandemic. I think the important is to be connected with the responsible ministries and the agencies during this period who are looking after the livelihood of the persons with disabilities and the other vulnerable peoples.
Okay. Thank you so much, Smriti and Yeti, for answering all the queries of the participants. I think mostly we have been able to answer. I will just share my screen for the last bit of announcement. Is my screen visible to all? So, the participants who attended today's session, they can get their certificate of participation by visiting our website, which is www.spearindiacovid19academy.org after 24 hours, and you will get your certificate of participation. We, for any queries, if you have any queries and your answer has not been fulfilled in the session due to any reason, you can write to us at COVID-19 Academy at spearindia.org.in, and we'll try to respond to all your queries through this. Uh, by this, I would like to also thank my speakers, Smriti and Yeti. Thank you for this very important presentation, and thank you for answering all the queries of the participation. Thank you, Anupriya, for being a great interpreter, and thank you for taking the interpretation for the entire session. Thank you all the participants for joining the session today. I'm looking forward to more of our sessions in future. So with this, thank you everyone, and have a great evening today. See you all. Bye bye.